start with our first speaker, Sarah Yip from Yale University. Thanks for joining us.
I want to thank Kangju and Lucina and the rest of the Diversity and Inclusivity Committee for organizing this special symposium on what I think is a really important topic. As you can see, I am not there in person. Due to some last-minute travel problems, I was not able to attend, and I'm also currently operating on very little sleep, and so please bear with me. I'm nonetheless really excited to be here to kick things off. So give me 1 second while I just share my slides, which is also hard to do when you've had very little sleep. Okay, and hopefully you can now see my slides. Great. Okay, so as I said, I'm really excited to kick off this session. My talk is really going to be sort of a relatively broad introduction about the importance of identifying sources of population covariation in large data sets to protect against model bias within the context of AI and neuroimaging. And I should preface this by saying I'm not an AI expert, but I think that we all need to be considering, how these tools are going to be affecting our analysis of large data sets. So as we know, neuroimaging research has undergone a profound shift in recent years, with expectations for sample sizes exponentially increasing. So this has led to a number of big data initiatives, including both coordinated data collection initiatives, such as the Chinese Kohler project, ABCD, and the UKB. But it's also led to these large post-hoc data pool initiatives, such as Enigma and Abide. And all of these data sources are incredibly rich and exciting and are poised to provide unprecedented insights into our fundamental understanding of brain function and development within the context of both health and disease. And they're providing the opportunity to do this work in unprecedented scale, or what some people refer to as population-level neuroscience. And critically, they're also doing this within this highly multivariate space. So this image is from the UK Biobank, which is, of course, this data collection initiative in the United Kingdom that includes neuroimaging data from tens of thousands of individuals. And the reason I'm showing this particular image is because I think it's a really helpful summary of the complexity of the space in which we're now operating. In other words, as you can see here, neuroimaging is only just one component of a very large multivariate space, which is also composed of things like genetic data and detailed phenotypic information, or in other words, variables summarizing other key individual difference factors. And so the complexity of this space, therefore, really readily lends itself to advanced algorithmic approaches. In particular, this space is an ideal candidate for AI-based analytics. Thus, in addition to entering this new age of neuroimaging data collection, we're also in a new age of neuroimaging data analytics. I couldn't resist using this image, just from a cover that we commissioned for a special issue a couple of years ago, but it seemed very appropriate for the topic of today's session. So what could possibly go wrong? Lots of data, lots of new tools. What could go wrong? So I think one critical consideration is that our use of deep learning and other AI methods can really inadvertently embed bias. So, for example, algorithms used in routine decision-making often use individual difference factors such as sex and race. There are instances of this across multiple levels of society, ranging from biases in who qualifies for community housing to who gets flagged for additional screening and security. This is no less true of healthcare, and this can have devastating consequences. These papers are just highlighting one example of a commonly used algorithm for determining a patient's need for a kidney transplant that resulted in delays to kidney transplants among Black versus white patients in the United States. In this particular instance, the algorithmic bias in question was in fact well known to the medical community. Therefore, it was something that researchers were able to argue to change, and we no longer use this algorithm. In contrast to that, though, AI-generated models can inadvertently embed bias in such a manner that seemingly sex and race agnostic algorithms may in fact be influencing model predictions in a manner that's much less transparent. So what do I mean by this? Well, as we know, models are only as good as the data that we use to train them. this means that models generated from relatively homogeneous data sets may poorly generalize to models generated from more diverse data sets. And some of the following talks will provide explicit examples of this. And this also means that models generated from more heterogeneous data sets can overfit to latent factors that are intertwined with factors such as social determinants of health and equity, leading to biased models. So one really classic example of this comes from an AI model developed by Amazon almost 10 years ago to screen job applicants, and which used as training data applications from predominantly male applicants. Thus, in addition to penalizing applications based on explicit indices of female sex, it also prioritized applications based on latent indices of male sex, such as use of specific words that were overrepresented in applications from males versus females. Thus, when we're applying AI tools to our large neuroimaging data sets, it's imperative that we first understand the sources of covariation that exist in our data so that we don't overfit to these latent factors. To address this, my group and others are working to identify key sources of population covariation in large neuroimaging data sets, such as ABCD. One early example of this work comes from a couple of years ago now, in which we used canonical correlation analysis to identify primary sources of covariation contributing to individual differences in lived experiences during the COVID-19 pandemic. We took as input over 17,000 variables from the pre-pandemic ABCD assessments. And then we related those to early, mid, and late pandemic experiences using assessments from almost 10,000 families. And when we did this, we identified two primary modes of population covariation linking pre-pandemic experiences to pandemic experiences. And both of these components turned out to be related to basic factors having to do with social determinants of inequity. So here we have the results for the first mode of population covariation that we identified. On the left, I'm showing you the correspondence between baseline pre-pandemic variables and COVID-19 variables for this first mode as visualized in this hexagon plot. And then above that, I've listed the baseline variables that emerged as the primary predictors of pandemic experiences for this mode. And so these included race, family income, and parental education. And then on the right, there's a visualization of the pandemic variables with the highest loadings for this mode, or the things that were being predicted by the baseline variables shown at the top. What we found was that non-white families, families with lower household incomes, and families in which neither parent had a postgraduate degree were more likely to experience negative pandemic impacts, including increased likelihoods of food insecurity and financial worry, increased concerns over COVID symptoms, and increased reliance on school meal programs. Critically, those with vulnerabilities in these social determinants, for example, those with lower household incomes, were also more likely to express concerns about experiencing racism in relation to the pandemic and to have parent-child discussions regarding pandemic-related health and prevention issues, including things like hand washing and protecting the elderly and maintaining social distancing. In contrast, white families, those with higher pre-pandemic incomes and the presence of a parent with a postgraduate degree, experienced relatively reduced COVID-19 impact, as indicated by factors including decreased food insecurity and financial worry. This visualization is just highlighting that there were clear linear relationships between covariation in these COVID experiences and indices of baseline family income and community poverty. The second mode of population covariation that we identified in this study was also related to social determinants of inequity, in particular to basic pre-pandemic factors, including family size, parental marital status, parental language preference, and parental employment. And what this mode revealed was that single-parent families, Spanish-speaking families, and families without a stay-at-home parent experienced increased impacts of the pandemic, including changes in family routines, impacts on child healthcare access, impacts on child sleep, and impacts on child schoolwork and child screen time. In turn, these increased childcare needs were associated with impacts on parental employment and household responsibilities and parental perceptions of pandemic severity. Children from these families were also less likely to be rated by their parents as prepared for the next school year. They were described as spending more time on schoolwork and yet experienced increased difficulties completing schoolwork remotely. And finally, these families were more likely to report adhering to social distancing measures, such as avoiding restaurants and stores. So this work really just demonstrating that basic demographic and social determinants of inequity were the primary drivers of day-to-day experiences of pandemic experiences. So these factors emerged as predictors above and beyond thousands of other variables, including those related to pre-pandemic mental health. So these findings have really clear public health implications as they demonstrate the disproportionate burden of pandemics on racial, ethnic, minoritized, and marginalized populations. But within the specific context of this talk, however, these results are also demonstrating the need for analytic approaches that are capable of capturing complex, multivariate associations in large, diverse data sets. To that end, our more recent work has focused on leaning into this complexity using deep learning to identify sources of population diversity, again, this time within the context of ABCD. So this was work led by Justin Rhoda from Daniela Stock's group at McGill, and the schematic summarizes just the workflow in which Justin trained a conditional variational autoencoder across a range of hyperparameters and benchmark performance against principal component analysis. And the performance was benchmarked just based on the model's ability to successfully reconstruct unseen test data. As summarized in the middle, the best performing architecture outperformed PCA with a mean reconstruction loss that was more than 2 standard deviations below that of PCA. And we then ranked the components identified in terms of explained variance, which left us with 10 key modes of population variation, which we retained for interpretation. We're really still working to unpack these data. So I just want to briefly highlight some of the associations that emerged when we went on to explore what was contributing to these components in a post-hoc manner. So when we interrogated these components, what we found was that there are distinct dimensions of population diversity driven by factors related to socioeconomic status and other environmental factors, which together can be broadly categorized as social determinants of health. So this Manhattan plot shows variables whose weight strength for the first component ranked in the 95th percentile in our post-hoc analyses, identifying variable importance. So variables exhibiting the strongest weight for this component related to high poverty and public assistance rates, as well as low economic resources and child opportunity levels. Other phenotypes related to poor working memory task performance and indicators of mental health and social interaction also emerged as contributing to this component, suggesting a connection between economic resources, aspects of social behavior, mental health, and cognitive performance. Other components indicated separable complex aspects of population covariation. So for example, dimensions of diversity characterized by social and structural determinants, including low home ownership rates, high population and housing densities, recency of immigration, and household language preference that were intertwined with aspects of anxiety and stress. So this work is really, again, just suggesting that complex interactions between diverse assessment domains are widespread in population-level data sets, and therefore these must be considered in AI analyses of neuroimaging data. So by beginning to untangle this intricate web of complex associations, our hope is that our findings can point future studies toward which multivariate covariant diversity factors should be included for a given brain behavior modeling effort when investigating specific phenotypes of interest. This is really critical as prior work using relatively straightforward predictive models has demonstrated that brain phenotype models can fail for individuals who defy sample stereotypes. So for example, this is work led by Abby Greene from Todd Constable's group, in which they found that models predicting IQ performed poorly on individuals who were highly educated yet had a low IQ, and vice versa, and also that models performed differently in white versus non-white cohorts. I want to again highlight here that this foundational work wasn't even done using a deep learning approach. It was done using a relatively simple approach, meaning that the authors were able to uncover these sources of bias in a relatively straightforward manner, which is unlikely to be the case for studies using more complex analytic architectures. I started off by highlighting that we're entering this new age of neuroimaging data collection and analysis. The data sets being collected today are completely beyond anything I could have imagined existing during my PhD. So this is an extremely exciting time to be in neuroscience. And really the purpose of this symposium is not to dampen enthusiasm for big data or for advanced analytics, but rather I think to highlight that opportunities for unprecedented insight also come with unprecedented challenges. To that end, it's incumbent upon all of us to be aware of the potential for advanced analysis approaches to embed bias, and for the need to collect more inclusive neuroimaging data sets, as highlighted in a recent paper from Jocelyn and Carrin, from Holmes and others. I was fortunate enough to be involved in a follow-up to this paper in which we put forth recommendations for embracing intersectionality in neuroimaging, which is currently in press at Nat Neuro and led by Alicia Domla, who is also hosting a roundtable tomorrow on this work, which I encourage you to attend. So that's the Fostering Inclusivity in Neuroimaging Research roundtable tomorrow. With that, I'll thank you for listening and thank my co-authors on the data presented today, as well as the Diversity and Inclusivity Committee for inviting me, as well as OHBM for letting me send this recording in my last minute travel issues. Some of my collaborators, Jakob, I think I'll be shedding maybe off are hopefully there and on hand to answer questions, but also please don't hesitate to just email me directly with any questions. Thank you so much.